as being stressed out, because stress can lead to so many other things. So if you're stressed out and you're not speaking up or talking to someone, that could ultimately lead to more severe mental issues. Things that will make you not think like you normally think, things that will make you hide in your bedroom and not want to come out, things that will make you just want to sleep and just continue sleeping for good. So some of those things, we need to start talking about them. But because of the stigma that has been attached to mental health, a lot of people do not speak up. Being a nurse for 20 years now, I see patients on a daily basis who come in with diagnosis of anxiety and depression. And you have a nurse go into a room and look at the patient, oh, that patient is not really talking. Or they have a flat affect. Have you really looked into what the bottom problem is, the underlying issue? We're not talking about it because you don't even want to question the patient about those things because it's very sensitive, because the awareness is not there. Yes, we have a mental health month. What do we do in those months? Maybe some of you politicians in the room say, oh, I'm going to do A, B, C, and D, but when you win office, then it's gone, and nobody talks about it again. So it is time we hold our leaders responsible, and we hold ourselves responsible, because it must begin with you. Any change that you want to make has to begin with you, and start talking about it so that we can bring awareness and find solutions to these problems. And another thing, because cultural competency is my pet peeve, when you are not culturally sensitive, culture is not a race, culture is not an individual. Culture is us sitting in here right now is culture. So a mentally health individual is a culture. So if we are not sensitive to their needs, how can they come talk to us about what is bothering them? So it is time we bring awareness, but more so cultural sensitivity to these issues, so that these patients, these individuals, can feel comfortable to come up and speak about their issues.
Thank you. Thank you, Dr. Gwanmesia. That's awesome. And like she said, mental health, mental illness could be something like anxiety disorder, mood swings. Do you hear your children talk about mood swings some days? And then the next thing you hear in the news is a teenager that committed suicide, and they just discussed with their parent about thinking about suicide. What do we do when a child comes to you and say, I want to take my life? You know, what do you do? How do you deal with that? I'll pose that question to Ms. Gray.
I would say when a child comes to you and says that they no longer want to live, they want to take their life, the first thing that I would do is I would sit them down and find out exactly what's bothering them, because clearly there's a root cause that's making them feel that way. It could be bullying, it could be family life situations, it could be relationships. I know many times we'll tell our kids they can't date, but they're dating. And so you sit down and you talk to them, and you try to have an understanding as to what's going on, and you get them the help they need. I am not the kind of parent who takes that kind of stuff lightly. I'll tell you a story. I just had a situation at my workplace where my coworker's son had came home and said that his friend had said that he wanted to take his life. Now, the boy's 5 years old. So my friend thinks, oh, that's not a big deal. They're just probably talking. I immediately said, no, it is a big deal. Yes. You pick up that phone right now and you call the school, and you make the school aware. Because kids are committing suicide early. Yes. You know, whether it's because they're watching what someone else is doing, or it's because of something that's really going on. And I don't think children, when they're that young, they really understand the depth of death. You know, they look at TV and they see their superheroes coming back to life. I don't think they really quite understand it at some ages. And so it's important for us to educate them. It's important for us not to push it under the rug and act like it's not a problem, or tell them they're just talking crazy. It's important for us to take that time as parents, as friends, as neighbors, as aunts, uncles, mothers, fathers, to sit down and find out exactly what's going on, what's causing the issue, give them the help they need, and don't minimize it.
Thank you. Great. And my next question I will address to Ms. L.T. Bridgen. Do you think social media has an influence on mental health, what maybe children or even adults see on social media, do you think that has any effect on mental illness?
Thank you. Well, I honestly feel like social media has an impact on everybody in so many different ways. A lot of it, with everything, is what you come to it with, right? We all have perceptions, but that's based on basically what our lives have been up to that point. And a lot of times, people who are on social media don't understand that they basically have a public platform and that there are all manner of people who are seeing and hearing the things that they're doing. So people post things that they think are harmless, right? They don't think that it's causing any harm to whoever is watching. It didn't bother them. They don't feel like it's, any big deal to them. But what happens is it depends on the state of mind that somebody's in when they come to something and when they see something, because you have to take at whole what's going on in someone's life. For, example, I grew up as a very, very bullied kid. School was miserable for me. Thank God we didn't have social media back then. But in this age of social media, things that you hear at school and then in whatever your environment is at home, and then you go to social media, sometimes you see it reinforced that you are a nobody, that why are you here, or, you should just give up, and it just kind of will either put you closer, deeper in depression, or sometimes I find that it does lead, to kids committing suicide. And one of the things that, as you were saying, kids are committing suicide earlier, that just, when you hear my story, you'll know. But there were so many times I didn't want to live when I was 5, when I was 6. I had no concept of what that means to kill yourself, though. Like, there was just no idea of what suicide was to me. It was just a feeling I don't want to live. But now, because we have so much media and technology, and a lot of times and not a lot of governance around it for kids, so they have the same access to it as adults, that they know now how to actually, commit these acts and, call it suicide. And so it's just being mindful that what I'm putting on social media is not just impacting me. So I may feel fine with it. It may not bother me, but and that's one of the things that we have to be, is more self-aware of everybody in the world, because most of the time, we live in our space and we're okay with it, but we have to be conscious that, hey, we may be impacting somebody else by what we do and say. So absolutely, I think social media has an impact.
Thank you. That's wonderful. Thanks for that response. I'm going to take a little cultural spin, because I'm glad we have a very diverse panel. We are people of African and African American descent, and we all have very different experiences culturally. I'm going to pose this question to Linda. How is the African experience of mental illness? Is it evident that we have mental illness in our community? Is it accepted? Is it acknowledged? What are your thoughts on mental illness within the African community?
Thank you for that question. I think, like every other society, of course, Africans have mental health issues, and they may deal with it differently. Because I know growing up back home in Cameroon, West Africa, we walked around and saw people that lived on the streets, and we use the word craze. You can look that up. But it's showing that they are not okay. They're dealing with mental health issues. Those people literally, they don't take baths, they just live and eat dirt. They eat from garbage cans and stuff like that. And we're scared of them. You walk on the streets and you're very scared of them. But those are people that are dealing with inner mental health issues. And some of them really were drug related. They smoke marijuana, and some of them just maybe stress, or some of them just medically related mental health issues. But they are people dealing with stuff. And then you see the abandonment. Because you would hear somebody say their family leaves so-and-so place, but if they have a family, why are they on the streets? Some of them, they've said, we cleaned them up and they went back to the streets. That's because they are not mentally cognizant of what is going on. So maybe we need to solicit and give them the help that they need, not just necessarily bringing them back home. So we do have mental health issues back home like any other society. And then just you and me, because there may be people like Dr. Gwanmesia said that are dealing with, mental health issues from different perspectives. And some men, especially, or women just of African descent, don't feel comfortable really coming up and saying, I have mental health issues. it's a stigma, because it's so stigmatized that if you have mental health issues, there's something wrong with you. Yes, there's something wrong with you, but there's something wrong with everybody, you know? And, you know, people need different kinds of help.
Yes.
So we really need to get at a place where we are, number one, accepting,
Yes.
so people can feel comfortable coming to us. And number two, we should be resourceful. Because when somebody comes to you, then what?
Yes.
You may not be able to help them, but you may know somebody that knows somebody that knows somebody that can give them the help that they need. So when we can get to a place where we're accepting of everybody and we make the people around us feel very comfortable. So in the last week, I've actually not lost people that I know personally, but 3 people have died just within a week that I know. And just driving here this morning, it was a meditation thing for me, that we have to get to a place where we wake up every day and say we will be kinder to everybody, we would be